We had been really, really struggling with the cost of our health insurance for well over 10 years. And we'd made numerous changes to our plans, first implementing a high deductible plan with an ICHRA that then got too expensive. So we went to a high deductible plan with an HSA. We had to continue to change where our deductibles were. The premiums continued to escalate. And then we hit a year where our loss ratios got really, really ungodly high. We had a couple of employees and their family members who had catastrophic illnesses hit them. And unfortunately, as not a gigantic employer, just a couple of high claims like that can shoot your loss ratios through the roof. So when we got to our renewal for 2022, we were initially hit with a 100% increase to our premiums. We're like, is there an extra zero in there that, what? And we shopped heavily. We looked at captives, we looked at level funding, we looked at self-funding, we looked at every option we could possibly think of, and not a single carrier would bite on us. So we were forced to stay with the carrier we had. We did negotiate it down to a whopping 60% increase, and it was absolutely unsustainable. So we decided that we would take the year, and we did this within 6 months, to really figure out what can we do? Is there something creative out there that might be a solution for us that is not going to harm our employees? Because we didn't see it as a true option to just pass all of those costs on, or the majority of those costs on to our employees. So it was right about 3 years ago, I had started to hear the term ICHRA. I didn't know what it was, but I started to do some research, and ended up coming to our CFO and our president, and I said, look, there might be something to this. I need to do more research on it. I need to figure out a bit more on it. I'm having trouble finding people to talk to about this because it's quite new. But we put together a working group of trustees and the CFO and myself. We found another organization that had implemented this just ahead of us, so that we were able to pick their brains about how their experience was, how their design was, and we decided we were ready to take the leap on implementing an ICHRA. So we did it on a pretty shortened time frame. We ultimately decided to move forward with it at the beginning of March, and we implemented by July 1st of 2022, so that we could at least have a half a year of savings for that first year, and went through a vendor assessment process, lots and lots of discussions and evaluation of design options. And ultimately, we saved $1.4 million our first year with it as the employer, and our employees saved an average of $1,200 per year in premiums. But not just the savings on the premiums, they also were able to get a significantly more valuable benefit than they were getting through our group health plan.